For decades, peptide therapies aimed at the brain have faced the same biological challenge: access. The brain is protected by the blood-brain barrier, a highly selective defense system that helps keep harmful substances out, but also limits the entry of many potentially useful molecules, including large, water-soluble peptides. When peptides are delivered by subcutaneous or intramuscular injection, they first enter the peripheral bloodstream. From there, they may be exposed to enzymes in the blood and liver that can break them down before they ever reach the central nervous system. Even if a portion survives, the blood-brain barrier can still restrict how much reaches brain tissue. The result can be slower onset, lower brain exposure, and more systemic distribution than intended. Intranasal and nebulized delivery offer a different route. Instead of sending peptides through the entire bloodstream first, these methods use the upper nasal cavity as a potential gateway to the brain. The olfactory and trigeminal nerve pathways provide anatomical connections between the nasal region, the cerebrospinal fluid, and areas of the central nervous system. In scientific and clinical research, this nose-to-brain pathway is being studied as a way to improve delivery efficiency for certain neuroactive peptides. Compounds such as MIF1, C-LANC, Cmax, oxytocin, DSIP, and cerebrolysin are often discussed in relation to mood regulation, stress response, reward signaling, neuroplasticity, and recovery-oriented brain health. However, the regulatory status, evidence base, and appropriate use vary widely by country and clinical context. The potential advantage is not simply convenience. For conditions involving cravings, anxiety, dysregulated reward pathways, or mood instability, timing matters. A delivery route that may support faster central nervous system exposure could be important when symptoms escalate quickly. Researchers are especially interested in how intranasal approaches may influence regions such as the amygdala, prefrontal cortex, striatum, hypothalamus, and hippocampus. There are also practical benefits. Needle-free delivery can reduce injection-related discomfort, needle triggers, and barriers to adherence, which may be especially relevant for individuals with substance use histories. A nasal applicator or precision nebulizer may also support more controlled, repeatable dosing when properly formulated and medically supervised. But formulation is critical. Peptides are delicate molecules. Effective nasal or nebulized systems must consider pH, stability, absorption enhancers, mucoadhesive carriers, droplet size, and protection from enzymatic breakdown. For nebulized delivery, vibrating mesh technology is often preferred because it can create a fine aerosol without using heat that may degrade sensitive compounds. The big idea is simple. Treating the brain by flooding the bloodstream is often indirect. Intranasal and nebulized neuropeptide delivery may provide a more targeted pathway for research and clinical exploration by using the body's own nose-to-brain anatomy. This field is promising, but it is still evolving. Many peptides remain experimental, investigational, or research use only, and none should be used without guidance from a qualified medical professional. Always consult a licensed clinician before considering any peptide therapy, especially for substance use disorders, mood disorders, neurological conditions, pregnancy, medication interactions, or complex medical histories.